Hello and welcome everybody to today's Hypertension Management You Can't Beat a Healthy Heart class. My name is Vanessa Alardo and I work for Beaver Medical Group as a corporate health and wellness educator and registered dietitian. So in today's class, we're going to go over a few things about blood pressure management and how you can start to change some lifestyle choices to make better choices so that you can reduce your blood pressure. So the first thing we're going to go over is what is blood pressure. For many people, they don't understand what that means or what their numbers mean, so we're going to go over that briefly. We're also going to talk about who is at risk for high blood pressure and what risk factors that you can change so that you can control your blood pressure a little bit more. And then we're going to talk about those lifestyle changes that you can make, such as smoking cessation, creating a healthy weight, and also utilizing the DASH diet to be able to lower your blood pressure, increasing your physical activity, and then also reducing your stress. So let's go over those all individually. So what exactly is high blood pressure? What is blood pressure in general? Basically, blood pressure is the pressure that blood exerts on your artery wall. So you'll see right here on the right-hand side, that's an artery, and the blood that's flowing through is the pressure that's creating on that artery. So when your doctor tells you that you have high blood pressure and it's 140/90 or above, that's the pressure that's being exerted on that artery wall that's causing that number to go up. So when the pressure is lower, your number is going to be lower, such as 120/80 or 125/85, something like that. So the less pressure that's going through your artery means that your numbers are going to be lower, and the more pressure that's going through the artery means that your numbers are going to be higher. So that's what high blood pressure is, and that's what blood pressure is in general. So what do the numbers mean exactly? Typically, there's two numbers that are recorded. So you'll see a top number and a bottom number. The top number is called your systolic blood pressure, and that's the pressure when the heart beats. So whenever your number is 120, that's when your heart is beating. If it's 140, that's how fast your heart is beating or how much pressure is being exerted on those walls to cause that number to go up. The diastolic number is the bottom number. That's the pressure when the heart rests between beats. So whenever your heart stops beating, that's the number that's being recorded. So that's the two different main numbers that you're going to see, or the only numbers that you're going to see actually, is the systolic and the diastolic. So again, you want that number to be closer to 120/80 as opposed to something higher like 140/90, which is hypertension. So again, just to reiterate those numbers, the AHA recommends for healthy blood pressure the following numbers, and AHA stands for American Heart Association. So for it to be normal, you want it to be 120/80. Again, if it's a little bit above that, that's completely fine. It might just be that you were rushing around when you took your blood pressure, and that's why you got a little bit higher blood pressure reading. Pre-hypertension would be anywhere from 120 to 139/80 to 89. And then high blood pressure would be 140 or greater, and also your bottom number diastolic would be greater than 90. High blood pressure stage 2 would be 160 or higher, and then your bottom number would be 100 or higher. And then hypertensive crisis would be anything above 180 for your top number, and for your bottom number it would be above 110. So if you ever see it that high when you're at home and you're checking it on your own, or when you're with your doctor, then that's when you would want to go to the emergency room to get it checked by a physician and make sure that everything's okay and get it under control within the emergency room. 1 in 3 adults actually has high blood pressure above 140/90. So definitely hypertension is on the rise in America, and it's something that we really want to start to control and pay attention to because it is a silent killer. For many of us, we don't really feel high blood pressure. It just starts to happen and we don't know it, and so that's why it's good for us to check it regularly throughout the day so that we know whether or not our numbers are high. So what exactly is happening when we have high blood pressure? So most people just think it's something that's normal. You know, you're told you have high blood pressure. Most people have it, so we don't give it a second thought. But this is exactly what's happening in your artery walls when you have so much pressure going through it. It's basically causing little tears. So if you think about a balloon having too much pressure in it or too much water, eventually it's going to start leaking or burst because it can't handle all of that. So the same thing is happening with the artery wall. It's causing those little tears because of all the pressure that's going through that small vessel. So then what happens is you have the plaque buildup that you'll see right there in the yellow. It's pointing to that exactly. So when the tear happens, that plaque starts to build up from the different foods that we eat and the fat that we're eating from different foods. So then over time, what happens is atherosclerosis, which is a bigger buildup of fat within the artery walls. So all those tiny cuts just start to collect that fat, and now you have an even smaller opening, causing your blood pressure to go up even more. And then that could then lead to different things such as heart attack or stroke. So whenever you have that atherosclerosis and it makes it really hard for the blood to flow, at some point it might become completely stopped, and that is when a heart attack happens, or it may become completely stopped to your brain, the blood flowing to your brain, so that's when a stroke happens. So those are your two risk factors for having high blood pressure, and that's why we want to begin to monitor your blood pressure more and make sure that we get it under control, because these are two very serious things that could occur in your lifetime, and it's something that we want to reduce the risk of. So who exactly is at risk for hypertension? These are unavoidable risk factors that occur with hypertension. Age is definitely one of them. So your age is a contributing factor to whether or not you're going to have higher blood pressure. As we get older, our blood pressure tends to go up. So that's a common thing that happens and something that we can't really avoid because, hey, we're all going to get older. It happens to us. And so we can't really prevent that unless we find a fountain of youth. And if you find that, let me know. But for most of us, we're going to continue to age. Family history is also another risk factor that's unavoidable. Basically, whatever your family you were born into, you can't change that. And genetics is a real thing. So, when you fill out that form when you go to the doctor, it asks you your family history, whether or not you have heart attacks in your family or cancer. All of those things are contributing factors to whether or not you're going to have high blood pressure. Gender is another one. So after the age of 55, women are at a higher risk for high blood pressure rather, and so are men due to the lower production of estrogen in females, actually. I shouldn't have said men. But women are at a higher risk because they have a lower production of estrogen. Race is another factor. So African Americans are more salt sensitive, and so 40% are more likely to have a high blood pressure reading. The good news is you can make some lifestyle changes to start to lower your blood pressure. So let's take a look at those. Again, we can't change the cards that we're dealt. So in other words, you're going to be born into a specific family. You're going to have certain genetic factors that are going to contribute to your lifestyle and the way that, different disease states might happen to you. But you can control your lifestyle. So what we want to start managing is our weight. We also want to become more active. If you are a smoker, we want to learn how to stop smoking or at least start to get into that direction. You also want to control your nutrition and be able to eat healthier and then learn to manage your stress. So we're going to go through each one of those individually and hopefully you can learn to make some lifestyle changes. So the first thing we're going to talk about is reaching a healthy weight. How can we do that? You want to be able to balance your plate. So this is what the My Plate looks like. And basically it's a well-rounded, balanced meal that has half of your plate as veggies. So you can pick whatever veggie you want, whatever floats your boat, whatever color you might like. All veggies are wonderful. So pick which one you like. Then you want the other fourth of your plate to be carbs. And you want it to be a complex carb. So anything that's like brown rice, or if you want to do quinoa, or you can also do like a whole wheat slice of toast, something like that. Then you want the other fourth of your plate to be a protein. And again, that should be a lean protein such as salmon or chicken breast or turkey breast. You want to limit the amount of red meats that you eat throughout the week. Maybe limit it to once or twice a week or once every 2 weeks, something like that. But you definitely want to eat your white meats above your red meats. You also want the size of your plate to be about 9 inches. Anything bigger, you're going to end up putting more things onto that plate and just overloading it with more food than your body actually needs. So definitely take a look at the size of your plate when you get home. See if it's something the size of a salad plate, or if it's bigger than that, definitely try to buy something that's smaller if you don't already have it, or you can always just fill up half of your plate. Also, taking a look at the portion sizes that you can use your hands as serving tools. So basically, the protein serving should be about the size of your palm. That's about 3 to 4 ounces. For a cup of veggies, that would be your fist. If you make your hand a fist, that's about a cup of veggies. For fats, if you use your thumb, that's about 1 to 2 tablespoons. And then if you use your palm again, for carbs, you can see that half a cup is a little bit smaller than the palm of your hand. So I know this might surprise a lot of you and may be shocking and also disappointing because most of you probably eat more carbs than your body actually needs. And that's where we get that retention of fat, and that's where the blood pressure starts to go up. So you really want to make sure that you're utilizing your hands to be able to use them as a visual to know how much food you're going to put on your plate. Dietary fiber is also really good in reducing your weight. There are studies that show that increasing your fiber by 14 grams a day can actually help you to lose more than 4 pounds in about 4 months. So that's actually really good. The unfortunate side is that most Americans are deficient in fiber. So how exactly can we get more fiber into our diet? You want to get more complex carbs. So good fiber is going to come from your whole grains, your fruits, your vegetables, your legumes, nuts, and seeds. Typically, we eat more refined carbohydrates here in America, such as white bread. We'll have a PB&J on white toast rather than whole wheat, or we have the flour tortillas rather than corn. And so you really want to make sure that you're using those complex carbs as opposed to the refined carbohydrates that most of us are eating. It's really easy to get in your fruits and vegetables. So most people are intimidated by eating fruits and vegetables, and it doesn't have to be that way. So this picture here shows you how easy it is to get in your fruits and vegetables for one day. Each picture shown is 1 day's serving for one individual. So you want to get in 2 servings of fruit and 3 servings of vegetables. So you'll see in the first photo, there's a nice salad. That right there is about 3 servings of vegetables. And then your 2 fruits are going to be your apple and your raisins. So those are your 2 servings of fruit. Again, if you look to the right, you'll see there's a cup of applesauce, a banana, and then we have a pepper and salad. So again, that's 2 servings of fruit right there and 3 servings of veggies. So you can take these examples if you want. You can use them on your own. If you want a handout of this presentation, we can make it available to you so that you can have this ready and available next to your fridge for any time that you want to make a healthy snack, or you want to make sure that you're getting all your fruits and vegetables for the day. This can be a really handy tool. If you want some tips on how you can get more fruits and vegetables into your diet, try and buy pre-cut vegetables and fruit. It makes it way easier when you're on a time crunch to grab that and go, rather than sitting there and cutting and prepping and washing and all those types of things. Also, you want to choose healthy plant-based fats. So instead of having saturated fats and trans fats that come from those red meats that we talked about earlier that we want to monitor, and also from trans fat that comes from eating out a lot, basically any food that you eat that's purchased through a fast food lane typically will have more trans fat in it. So those are the fats that you want to limit. And the ones that you want to have more of are going to be your MUFAs, PUFAs, and omega-3s. So basically your MUFAs and PUFAs are more flexible fats that don't end up clogging your arteries, as I showed you in the first couple of slides, how your arteries look when you have fat clogging them. Those are typically fats that are going to come from your saturated fats as well as your trans fats. But your MUFAs and PUFAs are flexible fats, such as olive oil. You notice that at room temperature, it's liquid, so it's easily able to pass through your arteries without getting stuck in them. So again, olive oil is really fantastic. You can cook with it, you can bake with it, you can do lots of cool things with it. Canola oil is also really great. Peanut oil, safflower oil, sesame seed oil, and avocado. A word of caution with the avocado, I know a lot of us like it and it's super easy to eat because it's creamy and it's soft, but you want to use it sparingly. You don't want to have a whole avocado every day, unless of course you're vegan and it's a replacement for other things in your diet such as meat. But definitely avocado you can use as a spread. You can eat half of it instead of the whole thing. So definitely use it sparingly. With your PUFAs, those are going to be soybean oil, corn oil, sunflower oil, fatty fish such as salmon, mackerel, herring, and trout. So for your fish lovers out there, you're in luck because those have lots of PUFAs, which are really good for you, as well as omega-3. So maybe you're taking an omega-3 supplement in the morning. That's perfectly fine, but you can also find it in fatty fish, canola, flaxseed, chia seeds, and walnuts. So if you want to use flax seeds or chia seeds for the first time, you can always throw them into a blender with your smoothie in the morning, and that's a great way to get it in. You can also put either of those onto your oatmeal in the morning, and another fantastic way to get your omega-3s in. Reducing sodium is another thing that we want to do when we have high blood pressure or we're at risk for high blood pressure. So definitely something to monitor, because over the past decade, there has been an increase in sodium intake by Americans. And the reason that is because we're going through the fast food lane a lot more often than we used to. And we're eating out more often than we used to. So you really want to limit your sodium intake to about 1,500 milligrams per day. That's not very much. And most people are surpassing that and taking in about 3,400 milligrams of sodium per day. So that's that's actually doubling the amount that we should be having. So you can see why high blood pressure is on the rise. It's also interesting that even though something they don't taste salty. So as you see here, there's Oreos that are sweet, but they actually don't taste salty, but they do have sodium in them. So you'll see right there that Oreos have about 160 milligrams of sodium. Even though it's not a high amount, if you're popping Oreo after Oreo, you can see how the number can rise very quickly. Also, Eggos are something that it's supposed to be sweet, but also has sodium in it. So it's about 410 milligrams of sodium in an Eggo waffle. So again, even though it's sweet, it still has salt in it. And that's because it's the way that it's processed in the factory. And also to be able to preserve that food item, there's sodium that's added to that food item to be able to preserve it and keep it longer in your fridge and your pantry and different things like that. So anything that you've had in your fridge or pantry for a long time, you better believe there's probably a lot of sodium in it to keep it that long lasting. Also, if you look here, we have Eggo syrup. You can see that's 180 milligrams of sodium in the Eggo syrup. So again, it doesn't taste salty, but it's in there. We also have, what else is surprising on here? We have cottage cheese. Again, well, we know that has high sodium, but even the light, which would be lower in fat, still has a lot of fat or sodium in it to make it taste good. So because they removed the fat or they lowered it to make it low in fat, they added sodium to make it taste better. So different things that you really want to monitor. You really want to start reading your nutrition labels to see which food items have higher sodium. And a little bit later, we'll talk about how to read a nutrition label and where to locate sodium. So here's some low sodium food options. We have 100, and everything on here is about 140 milligrams of sodium or less. So as you'll see here, we have the Bumblebee low sodium white albacore in a can, and that has about 180 milligrams of sodium. So again, that's not very high. Anything that you'll notice that has 140 milligrams or less would be considered a low sodium food option. And you're typically going to find that in your fresh food choices rather than the ones that are prepackaged, as I showed you earlier on this slide. All of these are prepackaged. They're very highly processed with both sugar and salt, but your fresh food options that come from plants and from the earth are much less have much less sodium than your packaged options. So nuts right here, you'll see a cup have about 28 milligrams, and a cup of kale has about 130 milligrams. 1 cup of broccoli has 71 milligrams. 1 cup of blueberries has 148 milligrams. Half a chicken breast has 87 milligrams, and 1 cup of beans has 172 milligrams. So all of these are very low sodium options. If we look back at this slide here, if you have 1 serving of or 2 Eggo waffles, you're up to 410 milligrams. So again, that's much higher, and you're at risk of going over your 1,500 milligrams of sodium per day if you eat these prepackaged foods. But if you eat these fresh foods, you're not as at high risk of going over your limit because they're so low in sodium. So something definitely to keep in mind when you're going out grocery shopping. Now let's learn how to read a nutrition label and where to find sodium on that. So the first thing that you want to look at on a nutrition label is the serving size. So on this label specifically, it's 1 cup. Then the servings per container will be 2. So basically, there are 2 total cups in this package, but one serving size is just 1 cup. Okay, so the next thing that you're going to look at, we're not going to go through all of the different details or line items, we're just going to go straight down to sodium, is the sodium amount, which is 660 milligrams. So as I showed you on the previous slide up here, you'll see that a low sodium option is 140 milligrams. But here, 1 cup or 1 serving of this food is 660 milligrams. So do you think that's a high sodium option? If you answered yes in your head, you're absolutely right. This is a high sodium option. The other way that you can tell is by looking over to the far right of where the sodium is listed, and you'll see a percentage value. Anything that's listed as 5% is considered low, and anything that's listed as 20% or higher is considered high. Okay, so this right here has 28% sodium, so that's considered a high sodium option. So this is something that you would want to have a half a cup of, or maybe even a fourth of a cup to lower the amount of sodium that you're taking in. So again, as I showed you in the last 2 slides, you notice all these different packaged foods. It's not that you can't eat them, it's just that you just want to monitor what foods that you're taking in and how much sodium they have by using nutrition label reading. You also want to increase your potassium. Potassium is wonderful in reducing blood pressure. So there were studies that have shown that after 1 year of taking adequate amounts of potassium, 81% of people on high potassium diets were able to cut their medications by more than half. That's astounding. So that's something that you really want to pay attention to. If you do have high blood pressure or are trying to manage it, you really want to increase the amount of potassium you're taking in per day. So the recommendation is 4,700 milligrams per day. And you might ask yourself, well, I don't know what that means, or I don't know how to get that in. But if you look at the far right table, you'll notice all the different foods that have potassium in them and all the milligrams that are within those foods. So if we look at a sweet baked potato, it has 694 milligrams of potassium. That's really high. So definitely try to maybe have a sweet potato, once every other day or once every 3 days, at least once a week to get that potassium in. You could also get it in tomato paste. A fourth of a cup has 664 milligrams, so that's wonderful. A baked potato that's not sweet has 610, so similar to a sweet potato. White beans has 595. So if you keep looking down the list, you'll see that tuna has 484 milligrams. So just kind of combining these things in different meals throughout the day can help to increase your potassium naturally. But if you aren't able to get it in naturally, you can also take it as a supplement. So definitely look for 1,000 or more milligrams of potassium in a supplement form, depending on whether or not you're taking it in through your diet. All right, let's move on to talk about physical activity. So it's really hard for some of us to get in that physical activity because we're so tired at the end of the day that we just don't feel like doing anything but sitting down, watching our Netflix, and just chilling out, right? That's why they call it Netflix and chill. But it is important that we start to check in with ourselves, make sure that our energy levels are up, that we're able to think clearly, that our anxiety is low, because if those things are high, it typically means that we're not getting enough activity, and it also means that we aren't able to manage our weight and that our blood pressure might increase. So for most of us, we get in that 1 hour of activity, I won't say most of us. For many of us, we aren't getting any activity. For some of us, we're getting that 1 hour at the gym, and then the rest of the 23 hours, we're sitting, doing the different things that you'll see on the right. Sitting at our desk, driving, sleeping, on our computer, reading, watching TV. So all of these things actually increase the risk for hypertension. Your heart needs exercise to stay strong and efficient. As I showed you in the first couple of slides, your heart is beating constantly. And so as it beats faster, it helps to strengthen that heart so that it can pump more efficiently and effectively, and so your blood pressure will go down. Other benefits of exercise are it helps you to lose weight. It also helps to increase your good cholesterol, which most people don't realize that they have good cholesterol. It's called HDL, and as you exercise and you do weightlifting, it actually helps to increase that HDL. It also helps to reduce the likelihood of clots. So we also talked about, heart attacks and stroke. And when you exercise, it helps so that you don't get those clots that then could cause a heart attack or a stroke in your brain. So the goal is to get 150 minutes per week of moderate intensity. So you should be able to talk but not sing with moderate intense activity. So as you're walking or as you're jogging, if you can talk a little bit, that should be fine. But if you are able to sing clearly and you sing like Sinatra, then you might want to increase your pace to a moderate intense pace. And if you sing again and your voice starts to shake a little bit and you're sweating and you're having to breathe a little bit harder, that means that you're doing an intensity that's good for you. So 150 minutes per week, and it could seem intimidating just looking at that number, but you can always break it down. Really, you want to be getting 10,000 steps a day. So 150 minutes a week if you don't have a step tracker, or if you have a step tracker, you can use that to get your 10,000 steps in, which I'm going to let you guess how many miles that is right now. If you guess 5 miles, that's correct. It's about 5 miles a day that you want to be walking. So again, as I mentioned earlier, you can break up either of these numbers, the 150 minutes per week or the 10,000 steps, into blocks. So get up in the morning, get a brisk walk in right before your shower. You can also do it in the afternoon, right after your lunch, to kind of get your digestive system going. You can even do it in the evening, get 20 minutes in the evening. So as you break it up, you're getting your steps in, you're getting your movement in, and that's so much better than just doing the 1 hour at the gym and then sitting the rest of the day. If you're a smoker, you really want to start thinking about maybe quitting smoking. We have a great program here at Beaver Medical Group. One of our preventive care specialists, Dr. Godot, teaches that class, and she's wonderful and has helped many people to quit smoking. So cigarette smoking is a major cause of heart disease. It's something that should not be taken lightly. I know it's a really hard habit to quit and to kick the can, but it is so important for us to do that. And the reason being is it creates part-time hypertension. So for many people who smoke, about 5 minutes after lighting up, their blood pressure starts to increase. So that's something that we really want to pay attention to. So every time someone smokes a cigarette, their blood pressure is going up 5 minutes after they've lit that cigarette and started smoking it. When you quit smoking, it actually helps you to increase your lifespan. So after 15 years, your risk of heart disease is close to that of a non-smoker. So even if you have smoked for a long time, after quitting, it really does help to increase your life expectancy as well as reduce your risk for heart disease. Some treatments for quitting smoking are your smoking cessation programs, the one that we have here at Beaver Medical Group that Dr. Godot teaches. And I'll have the number at the end of today's class so that you can always call our department if you want to start thinking about doing that. We also have nicotine replacement systems, not here in our office, but those are options that are available to you. And maybe you can start to talk to your doctor about getting those. They have the patch, chewing gum, nasal sprays. So something that maybe you want to talk to your provider about. And again, as I mentioned, the benefits of quitting are amazing. You really want to start considering it. And if you've been thinking about it, that's really good, because even just thinking about it is the right step in the right direction, or is one step in the right direction, right? So then just keep thinking about it, mulling it over, and then at some point maybe set a date to make that call to initiate that smoking cessation class or that smoking cessation one-on-one so that you can get the ball rolling in the right direction. And it doesn't mean that you have to quit that day that you come to see the preventative care specialist, but it just means that you're just initiating that ball and getting it rolling so that it's easier the next time that you come to keep thinking about it and potentially setting a date to quit. Stress is another thing that we want to manage, and the last thing that we're going to be talking about today. So stress is one thing that increases blood pressure, and a lot of people don't realize it because when you stress out, you don't really think about much else but your stress, right? But high stress from work, at home, and even when we sleep, because some people think a lot while they're sleeping and it wakes them up at night, all of these things increase blood pressure. So if you are feeling overcommitted at work or at home and you're not feeling rewarded for the commitment that you're putting into life, that can cause high blood pressure and also just mood swings and different things like that. It can also come from a relationship that's, you have conflict with somebody or conflict at work. All of those different things can cause stressors in different people's lives. But in order to manage your stress, you want to be able to transform it with these different approaches. The first is showing gratitude. Showing gratitude has been shown in many studies to be an amazing way to reduce stress. So counting your daily blessings is amazing. Even if you do it on your morning walk, your 10-minute walk that we talked about earlier, you can start to think about all the amazing things that are happening in your life and even just count 3 blessings for that day. If you can only think of 3, that's better than none. And every day that you do that, you just become a more positive, happy, grateful person, and that helps to reduce your blood pressure. Also, nurturing yourself is really important. So if you find that you're always giving, and never receiving, then just nurture yourself. You can do that on your own. You don't have to have others give to you to be able to nurture yourself. And how you do that is taking time for your interests and your hobbies, making sure that you are investing in whatever it is that you enjoy doing on your personal free time. Humor therapy is also awesome. You can always watch a funny movie if you're feeling stressed at night. Put everything down. If you take work at home, set it aside and set some time to watch a funny movie by yourself if you want, or with your family. And then meditation and visualization is also really wonderful in reducing stress either on the spot or even chronic stress. So let's do a quick meditation and visualization exercise to show you how wonderful meditating can be. So if you've never meditated before, there's no problem with that. It's very easy, and I'm going to guide you through the meditation, so you actually don't really need to think about how to do it. Just listen to my words and begin to relax as we talk. So go ahead and put your feet flat on the floor, legs uncrossed, and put your hands on your lap. Gently close your eyes and mouth and inhale slowly through your nose as you count to 4. Hold your breath at the top and then exhale slowly. Repeat this inhale-exhale cycle a few more times, allowing your belly to softly rise and fall with each breath. As you continue to inhale and exhale slowly, check in with your body and begin to relax your head, your face, your eyelids, your jaw, your neck, going all the way down to your toes. Your body should begin to feel very warm, heavy, and relaxed. You're completely present and in tune with your breath as you inhale and exhale slowly. Scan your body once more for any signs of tension and imagine the tension slowly releasing as your body becomes even more warm, heavy, and relaxed. Now I want you to think about being someplace that feels safe. It can be any place you choose. It is your place away from all the chaos and the noise. You have nowhere else to be but in this place right now. No other obligations, no appointments, no judgments, just you alone in your safe, relaxing place. Imagine you're really in this place, using all of your senses to see, hear, smell, and feel what it's really like to be there. Continue to breathe in slowly and exhale slowly. If any other thoughts enter your mind, just place them in a bubble and let them go. Continue to be in your safe, relaxing place, being fully present and in this moment. Now choose a word that represents this relaxed feeling and repeat it silently each time you exhale. You can repeat this word to yourself anytime you want to be transported back to your relaxed safe haven. Continue to inhale slowly and exhale slowly. The meditation will soon be ending, so begin to bring your awareness back to the room, and the meditation will end in 5, 4, 3, 2, 1. Go ahead and gradually open your eyes as you become more alert and aware of your surroundings. So I encourage you to take this relaxed feeling with you throughout the rest of your day. Anytime you're feeling stressed out, you can repeat your special word, and definitely try to feel this relaxed feeling anytime you're starting to get stressed out. In conclusion, it's really important that you understand the risk for high blood pressure, because in order to be able to manage your blood pressure, you want to know your risks as well. And we talked about those things being, age, your family, genetics, but also the lifestyle things that you can change, such as your diet, exercise, smoking cessation, all of those things to better your blood pressure and improve your outcomes. Also, you want to be able to check your blood pressure regularly so you can keep track of it using a calendar or any sort of tracking system that you have. And then lastly, but not least, you want to make sure that you reduce your sodium and eat a well-balanced meal, which we talked about with using the MyPlate. Thank you again for participating in this class and for learning a little bit more about how to manage your blood pressure. My name is Vanessa Lardo, as I mentioned earlier, and if you want to get a hold of me, you can always call me at 909-335-4131, or you can also email me at valardo@epiclp.com. We look forward to hearing from you, and have a wonderful day.